Peripheral neuropathy is quite a rare effect. There are many causes of peripheral neuropathy, and peripheral neuropathy itself is a condition that affects the nerves most commonly in the limbs, so the legs and the hands. Those nerves are important to transmit a signal from our hands and legs up to our brain. So any damage to those nerves may cause numbness. It may cause pins and needles or pain. It may cause loss of function, so weakness, or also loss of balance as well. This is a rather potentially serious side effect of this type of antibiotic therapy, which is why antibiotic stewardship is really important to make sure that these valuable medicines are used appropriately. So the current recommendations are that we should reserve them for more serious types of infections, and we should not use them for infections that are going to disappear by themselves, or for quite mild infections such as sore throats, for example, unless no other alternative is available. What we did notice is that the potential risk associated with this antibiotic seems to be smaller if the length of the antibiotic treatment is reduced. So if these infections could be treated more effectively by shortening the course of the antibiotic duration, then that might be one way of trying to reduce and minimize the risk. But there are still things that we don't know. Firstly, we don't know how long these reactions might last for. We don't know whether or not there are certain types of people or health conditions that are most at risk to develop this type of reaction. We don't know if there's any potential genetic risk factor that may lead certain types of people to develop it. And again, the interaction that the type of infection that's being used, the antibiotic that's been used to treat, has a role to play as well. So yes, these further research would be needed to answer those types of questions. It's quite difficult to study and characterize the risk of side effects from medicines, particularly when they rarely occur. So I would encourage any healthcare professional that if they come across a medicine and suspect that a medicine might cause a specific side effect, that they should report that side effect to their medicine regulatory authority using the yellow card system in the UK.